the perception of patients and their preferences have changed.
What an incredible panel we have right now. Top doctors and researchers in all of their respective fields, and we are talking about healthcare investments and how they really play a pivotal role in enabling value-based care while managing costs for both patients and providers. So let me start by asking Dr. Walid, what is value-based care, Dr. Walid, and why is interest in value-based healthcare growing exponentially?
Thank you very much. That's a very good question. We'll have to go back a little bit and understand how healthcare was formed in the past 100 years, and I mean modern healthcare. Modern healthcare, there are two aspects. First, whatever we have now is mostly what we call sick care more than healthcare. You wait for people to get sick, then they go to the hospital, and then we treat them. This have changed dramatically in this decade, where we are looking at things like longevity, wellness, and value-based healthcare. These are, as we speak now, changing how we are restructuring healthcare into a more focus on quality versus a volume that we used to do. So we're shifting from volume-based healthcare to value-based healthcare. If you look at the new initiatives that's happening in the UAE, for example, you have the wellness initiative, we have the longevity initiatives. We have an aging population, which we have to address the increase in chronic diseases. We have to put emphasis on how to make people live healthier and have a better quality of life. If you look at the shift also in the R&D market and the pharma companies, where the budgets are becoming less, and the payers and the providers are focusing more onto how to utilize the budgets more efficiently, and these all lead to a more focus on value-based healthcare and not volume-based healthcare.
So the shift from volume to value is key here. So value-based healthcare really means that doctors and hospitals are paid based on their patients' health outcomes.
Yeah.
So Dr. Asma, in this case, would you share some examples for us and use cases of value-based healthcare in this region?
Yes, thank you. Before I get into the examples, it's important to highlight that the governments are all well aware of the benefits of value-based healthcare. In fact, the UAE government is at the forefront, leading by establishing the systems and creating the framework to provide such value-based healthcare services. The first example is at the level of the nation, Riayati, which is a project by the Ministry of Health and Prevention. We're trying to create national health records. Malafi from Abu Dhabi is being merged with Nabad from Dubai, an excellent initiative which is allowing physicians real-time access to patient data. Imagine the potential in saving lives here, but it's not only that, it's also improving the efficiency and reducing the cost. Another local example is by the Department of Health and Medical Services, Abu Dhabi, Muashir. It's a quality monitoring framework whereby healthcare providers as well as facilities are being evaluated based on their quality output. Not only that, key metrics such as innovation, research, patient experience, staff welfare contribute to the scoring. And then ultimately this scoring is going to be linked to the provider's reimbursement. The higher the clinical outcome, the higher the score, the better or the additional value that the providers get in terms of reimbursement. In general, companies are all heading in the direction of the application of value-based healthcare. Another example which is close to home and one that I'm very proud of is our own project, which received the Gold Award from the Arab Hospital Federation just recently, and it's the application of artificial intelligence in retinal scan for diabetic patients. Yes, indeed.
Congratulations.
Oh, thank you. Thank you. The application of artificial intelligence enabled us produce results in less than 3 seconds when it usually takes 3 days. Obviously, the early intervention and the improvement of the patient outcome for the large population of diabetic patients that we have in the UAE. And finally, at the level of Pure Health Group, Pure Health invests and continue to invest in value-based healthcare solutions, be it teleconsultation or, let's say, diagnostics or early screening for cancer. All these investments are instrumental to the development and the success of the value-based healthcare.
So we really are seeing value-based healthcare implemented throughout hospitals and other facilities in the UAE. And Dr. Raza, could you enlighten us on how we can ensure that investments in healthcare make both financial sense and also prioritize what's best for patients, especially in value-based healthcare models?
So thank you very much. Very interesting subject. And my fellow panelists have defined value-based healthcare. My definition of value-based healthcare is improve quality of healthcare, improve outcomes, improve the quality of life of the individual, and manage costs. That's my take on that. I come from the provider side, and I would like to give some practical examples. And if we look at the universe of healthcare, ecosystem of healthcare, we see the maximum budget is being consumed by chronic diseases. And if we see in this part of the world, 15% of the population suffers from diabetes and consume more than 40% of healthcare budgets. So if we are able to make some meaningful difference in the management of diabetes, which we have started doing at Track Hospital in Ras Al Khaimah, we have come up with a novel concept of diabetes passport, in which what we do is we look at an individual holistically. Typically what happens that diabetic patients, forgive me physicians if they're sitting here, get stuck with GPs and physicians lifelong, and they end up ending into a lot of complications and end up in hospitals. World over, it has been seen, if patients could be managed well in outpatient environment, 40% of hospitalizations could be avoided. I'm giving you a live example of UAE. As per my discussion with insurance companies, the average spent to manage a diabetic patient is from 7,000 to 50,000 versus the average of 5,000 of a normal patient. So what we do in RAC Hospital, which is a good example, that a patient is holistically viewed, a diabetic patient, physician, cardiologist, neurologist, urologist, podiatrist, and nutritionist look at him and make sure he remains healthy and productive, and make sure he doesn't end up into any complication, and make sure his hospitalization is reduced. That is why save minimum 20% expense. So the value-based healthcare, this is the real example. We are trying to improve tangibly the quality of life, make sure he doesn't end up into complications, at the same time save 20% of the cost to the insurance company. So commercially, if you're talking to me from investment point of view, what do I get? I buy the loyalty of the patient lifelong, and the patient trusts me. That's more important. So that's my take on value-based healthcare, and I think there is a great lesson to learn, because we have a responsibility towards the community and society we are part of, and we have to keep contributing our bit. Success should come first, money always follows. So that is what value-based healthcare for me is all about.
Absolutely. 40% of cases in the UAE are chronic, so prevention is absolutely key. Dr. Walid, how would you say regional market dynamics really affect value-based healthcare?
If we take the UAE as an example, in the region. They have embarked on so many projects that will directly translate into value-based healthcare. Let's take, for example, the Emirati Genome Project that was launched in 2020. This program will restructure and reshape the healthcare as we speak right now by adding a very important aspect to healthcare, which is precision medicine or personalized medicine. When you have a population that you understand the underlying genetics of diseases and you understand their genetic makeup, you shift from the whatever currently we have now, which is one pill to fit them all, to more of personalized precision medicine that leads directly into cutting costs in refractive treatments, ensuring that people live longer, live healthier, and it makes you focus on what you need versus the textbook that we have of medicine. No. After the Emirati Genome Project, we understand better what do we need to focus on in the country, what do we need to spend money on, and that translates into value-based healthcare. There are other initiatives that are being now currently adopted by Department of Health and the Ministry of Health and DHA, which it also engages the other aspect, which is the pharma companies and the payers, into more models that ensure that the patient is getting the best quality and ensures also that the payer is reimbursing per quality and not per volume again. And we go back to the volume versus value-based healthcare. These initiatives will take time, but I reckon within the next few years you will see the outcome of that in having better healthcare and a better quality of life for all people, and a shift from only concentrating on people when they get sick to people living longer and healthier and having a better quality of life.
Mm-hmm. And value-based healthcare has contributed significantly to all of these projects, including the Emirati Genome Project, as you were discussing with me earlier, Dr. Walid. Dr. Asma, why should investors be interested in value-based healthcare? How much value is there in this system for the investors?
Why should they be interested? Because, of course, of the market demand, which is increasing. As my colleagues have highlighted, look, governments, healthcare providers, insurance companies, they're all trying to reduce the cost, control or reduce the increasing costs, but at the same time, improve the patient clinical outcome. The patient's preferences themselves are changing. And here I would like to quote our Pure Health Group Chief Operating Officer, Ms. Shaista Asif, who called the pandemic, COVID-19, the Chief Transformation Officer, because it was true. The perception of patients and their preferences have changed. They became more receptive to teleconsultation, telemedicine, video calls, and so on. A large segment of them still does until today. Value-based healthcare solutions are sustainable. They don't only positively impact the patient, but they also, on the long run, impact the community. Now, for investors, it's return on investment, and the return on investment on such solutions is obviously more profitable, and that's why you will see a lot of the investors are investing in companies that provide value-based healthcare solutions.
And just to expand on that, we have run out of time, but I'd like to hear from Dr. Reza very quickly. Just to expand on that, how can investors really help create new healthcare approaches, Dr. Reza, that focus on delivering better care and outcomes while keeping costs manageable? And this is your area of expertise,
I think this
isn't it?
is the most important question, and this is the need of the hour. We all healthcare students like me, we are in the most interesting phase of our life, because all the technologies are available in silos all over the world. We have burning issues. The cost of healthcare is going up, and the price is being controlled by insurance, and corporates want to pay less and less for healthcare. So the most important thing is to bring efficiencies into healthcare, improve outcome, and reduce costs. So the future models of healthcare will be integration of all the technologies. bring in IoT, big data, machine learning, AI. So this is my take next, the next hospital which I'm doing. My aspiration is to do a smart and complete digital hospital. The objective is the cost of treatment has to come down, inconvenience to the patient has to be reduced, patient experience has to improve. So the typical diagnostic time of days should be reduced to hours. And once the proper diagnosis is made with AI will tell you that this diagnosis, last month a patient was treated in Houston, and this is the line of the treatment, and outcome was 100%. So I am able to reduce the days to hours, maybe fraction, and thereby reducing the cost. Give you an example. A most important expense in healthcare is 50 to 60% is manpower cost. And the manpower ratio is 1 bed to 9 employees. If with the deployment of technology, we are able to reduce it to 6, you are able to reduce the cost of healthcare by 25 to 30%. And this benefit could be passed on to the entire ecosystem. And patient's inconvenience is converted into patient delight, because you are going to give him the best outcomes at fraction of a cost. This is what it is. I'll give you a simple example. There is a new software which is called generative AI. And 60% of a physician's time is spent in completing EMR. The generative MRI records your conversation with the patient, fills in the EMR automatically, thereby providing 60% more time to the doctor to see other patients. This is how, with the use of technology, efficiencies could be brought in, cost could be controlled, and patient's experience could be improved. These are the future healthcare models. I'm talking purely from practical provider point of view. So thank you very much.
Thank you. Incredibly efficient and cost-effective, and I'm sure you are already implementing these systems throughout your Ras Al Khaimah and your respective facilities. Thank you so much, Dr. Reza, Dr. Walid, and Dr. Asma, for sharing your expertise with us today. Thank you.
Thank you very much. Thanks.